This year, more than 600,000 people will die of heart disease in the US. With the rise of technological advancements, we have so much power in our hands to prevent deaths from these and other conditions. One strategy, telemedicine, aims to facilitate the patient-provider interaction. Unfortunately, these initiatives have not been able to incorporate diagnosis or treatment features. And that's where Qwik Life comes in. Now take a second to imagine your grandma. Perhaps her name is Nancy. She's 69 years old and recently had a hip replacement at UCSF. At this charge, she was given an app powered by Qwik Life. Today, she's having intense chest pain, and with one click of a button on her phone, tablet, or smartwatch, she's connected to the triage at UCSF's ER. And here's Dr. Aaron to show us what happens next.
Okay, so my name is Aaron, and so the application that we have right here, actually this would be the doctor's application, so they can see all of the patients that they are seeing over video, as well as any patients in the ER, and all the patients in the ER, as well as anyone waiting over video. And so as soon as Nancy, who it looks a little bit younger today, but as soon as she hits the button on her application, we thought about how a tablet wouldn't be close enough, and so just like LifeLink, now with smartwatches that actually have video, one button, and she can actually video right to me. So from there, I can actually pull in the data about her from remote monitoring from the HealthSuite Cloud. And so I can actually see in real time, because we're connected over DDP, we're using Meteor, that you can actually see it in real time. So then, this is once I hit dispatch the ambulance, but actually not only does it dispatch to the ambulance, it actually dispatches to all the people, all the healthcare providers in their GPS location who have opted into having AEDs within their car, because we know that time to defibrillation is actually equal to life, basically. And so the faster you can get an AED on someone, the better. And so healthcare providers from first responders all the way up are able to do AEDs. And so if you can get someone there while the ambulance is on the way, so I can video chat to the first responder, the ambulance comes, they take over, I'm still video chatting, I can tell them what medications to give, and then even monitor all the way into the emergency room. And then he's going to show you a little bit more of the data here.
Okay, so the dispatcher now can put a location on where this individual needs help, and then there is a nurse who is happens to be driving along 280 near Apple headquarters. I also have on my iPhone the same app to track me, and I will just say I can help. Oops, sorry, it's not spelled correctly, but. This is a hipster nurse up in San Francisco, but it's a little too far away, so I'm going to go hit up Nurse Ratchet to respond to our despondent Nancy in the bowels of Los Altos. Nurse, why don't you?
I'm sorry, time's up. Sorry, give a hand for Qwik Life. All right. And had you guys worked on this application before?
No, we did all the coding this weekend.
You did all the coding this weekend. So
I've been working on the concept for a while.
You've been working on the concept for a while.
Yeah, we just met.
But you just met.
All
Okay.
here, yeah.
All right. Okay. Thank you. So now we have judges.
Yeah, I have a quick question just as the feature you were last presenting. First of all, thank you for the presentation. So it looked like first there was going to be an automated dispatch to those of the region, but this looks like you're having to hand type in and wait for a response back and then reach out to the next person, which seems like that would create some delays. Maybe I misunderstood this part of it.
Yeah. So I mean, this is basically just to show that we can real-time monitor, let's say, somebody on a freeway. So what I'm doing on Nurse Ratched, we basically have an iPhone, an app. I didn't show that here, but the iPhone is driving down the freeway. So basically, to show in real time, we can capture this individual and then display that on the map. And so the idea is that the emergency room has to come to the doctor, and somebody has to make a call as far as what help is needed and who should be dispatched. Potentially, it could also be automated or.
So, although I don't think that young man was actually having a heart attack, let's say this guy was really having a heart attack and did need a defibrillator, and you put out a call to somebody in the car, what are the chances that somebody, even if they're a doctor or a nurse, I'm an emergency physician, I'm assuming you are too, and I'm not really very good outside of the ER, right? There isn't all that much I can do if I don't have my toys with me. Would you really just end up delaying the person getting to where they could get the definitive treatment?
So the idea is, I guess. The idea is, I guess, a little bit more like Uber, right? So it's automated to the point where you automatically video chat to the triage nurse at the ER, right? And then if determined that this person needs even a possibility of having like an AED, then that's one button dispatch out to the closest person. So say you're driving and your neighbor a block away needs an AED, and you have it in the back of your car because you just got a new Tesla and it's, you got it for free, right? Yeah, it came with it, right? And so then you can go right over there while the ambulance is on the way, because it's probably going to take them at least 20, 30 minutes. And so you put the AED on there, video chat to me as the doctor, and then the ambulance comes, so you're not actually delaying anything.
Yeah, I was thinking through that question about whether there's an Uber kind of effect here where somebody can self-select, but I'm not sure, because you also demonstrated, well, you can kind of maybe go straight to a person and say, hey, can you go over to this house, right? Because that seems like just the density of the calls are not going to be that high, that people are just going to be driving around and happens to be in a neighborhood where somebody happens to have an issue.
Yeah, and so we wanted to kind of show that it's flexible, meaning that, so like in an emergency, like in a situation where someone needs an AED, if you can send the request out to everyone in the area to say, hey, this is a real emergency, then that's one use case. But say you have like a quick box that has just like strep throat, influenza, those types of diagnostic tools, because actually telemedicine right now is actually kind of like malpractice, because you're not actually doing any diagnosis. All I can do is talk to you over video and send a prescription to local pharmacy. And the prescription rate is almost like 100% versus when someone actually has a diagnostic test. So something like this, say a nurse that's driving around, you could actually message that person to say, hey, do you want to take this call, when it's lower acuity, versus if it's higher acuity, then you send it, out to everyone.
Thank you. So are you seeing this as a dispatching technology? Because you're going to have a whole network of care processes in place for this to actually work, unless you're going to ask everyone who owns an AED to register with you like an Uber driver would. Maybe it's a dispatching technology? Is that what you're assuming?
Yeah.
And I wanted to add to that, since we've all mentioned Uber, they have partnered and, did vaccinations, I think in New York or something,
Mm-hmm.
and maybe you should partner with them and make sure they have AEDs in all their cars, because they're all over the place.
Well, and the other thing too is, in thinking about the ACOs taking on risks of population, you really need to keep people out of the emergency room. And so this having all of the nurses who want to have more flexible time, especially for the non-emergency type of situation with, being able to go and do like strep throat and flu and that sort of thing, they could get paid, and decide whether or not they want to take a call, and then they can go and, take care of those patients.
Okay, thank you very much. All right.